Good afternoon, everyone. Thank you, all of you, for turning to our live session today on Cancer Reach. As you all know, Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and the patient to access the right treatment on right time. Today, actually, it's a very lucky to have Dr. Krishnamani to understand about sarcoma, which is Dr. Krishnamani is our esteemed guest in the and expertise in the field of oncology. Dr. Krishnamani has more than 10 years of experience in the field, and Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. So this is actually a very unique opportunity for us to gain valuable knowledge on sarcoma, and that too in the month of July, which is also known as Sarcoma and Bone Cancer Awareness Month. So without any further delay, let's welcome our esteemed expert, Dr. Krishnamani, to enlighten us about sarcoma awareness. Thank you, Doctor. Thank you very much for joining us today.
Thank you. Hello, everyone. Welcome to Cancer Reach, which is an initiative to spread awareness about cancer. This being the Sarcoma and the Bone Tumor Awareness Month, we are emphasizing on sarcomas today. And it's a very big topic, but we'll try to cover what's more important from a patient point of view and from a general understanding point of view.
Thank you, Doctor. Actually, Doctor, when I heard the word called sarcoma, I guess there were many confusion created. Can you just brief us what exactly is sarcoma and...
So sarcoma is a cancer, okay? So, but cancers are divided on the basis of the cell of origin, we say. That is, from what cell it starts. So,
Yes.
if a cancer starts from something called an epithelium, then it is called a carcinoma. Sarcomas, technically, we say start from mesenchymal elements. Mesenchymal is like your bone, cartilage, soft tissue, muscle, etc. So anything which a cancer which starts from these cells or from this area is a sarcoma. So sarcomas usually are either bony sarcomas or soft tissue sarcomas. Bony sarcomas means the sarcoma which comes in the bone, in the thigh bone, which is called the femur, or the lower limb bones, which is called the tibia, or your humerus, the bone of the arm, etc. Soft tissue sarcomas are sarcomas which come in either in the head, in the neck, in the trunk area, in the abdominal area, or in the legs, extremities.
Okay.
So we divide sarcomas, whether they are bony or soft tissue sarcomas, and based on the part of the body which is affected.
Okay. So, Doctor, like in sarcoma also there are different types. Can you just enlighten on others?
So one is a bony and a soft tissue type. Then you are going to divide the sarcomas based on how the cells look under a microscope by your pathologist. So it could be a liposarcoma, it could be a leiomyosarcoma, it could be a synovial sarcoma, it could be an undifferentiated sarcoma, rhabdomyosarcoma, clear cell sarcoma, epithelioid sarcoma. So you can keep giving out multiple types of sarcomas. So sarcoma is a broad term. It's a cancer which starts in the muscle, soft tissue, etc. But when you do a biopsy and the cells, based on what they look like under the microscope, you divide it into different types. The commonest three are synovial, leiomyosarcoma, and liposarcoma. In the bony sarcomas, the commonest sarcomas are Ewing sarcoma and osteosarcoma. And Ewings and osteo are predominantly seen in young adults or adolescents between the ages of 10 to 20 years.
Okay. So, Doctor, as such, if you see this sarcoma is very much different compared to other types of cancer, if I'm not wrong.
Correct. So, when you talk about a lung cancer or a breast cancer, you're talking about a cancer starting in the lung or the breast.
Yes.
Here, the sarcoma can start anywhere. A bony sarcoma can be in the humerus bone, in the tibia, in the femur bone. Okay. You can have a soft tissue sarcoma in the head and neck area, in the trunk area. So, and they all have the same liposarcoma can have different ways of behavior in different people. So now you divided based on bone and soft tissue, then types of sarcoma. Now the liposarcoma itself can be divided into dedifferentiated lipo, myxoid lipo, undifferentiated, pleomorphic. So This myxoid and pleomorphic behave badly. They are aggressive. De-differentiated is slightly better. Doesn't
Hmm.
have chance to spread. Okay.
Oh, okay.
So not only your type of sarcoma, not only the place where it starts, not only whether it is bony or soft tissue, whether other factors also will decide whether it is a disease which can be managed or a disease which has a chance to recur.
Doctor, like listening to you about the types of sarcoma, just now you have rightly told that that's a very big thing, big information is there in the sarcoma, which is like difficult to cover in half an hour session, doctor.
Yeah, it is very difficult. There are multiple varieties based on what we call as histology. Histology is after you do the biopsy, what you see under the microscope is histology.
So, doctor, like in this sarcoma, can you just brief what kind of signs and symptoms are there, are seen?
So basically, before that, what we should understand is what causes a sarcoma. So many
Yes.
times sarcomas are de novo, we say. You don't know. They just come.
Okay.
There are genetic changes seen. When you biopsy the tumor and send for genetic testing, there are certain genetic changes seen in the sarcoma, that is in the tissue. Sometimes patients can have hereditary diseases like retinoblastoma, eye cancer, or a
Oh,
disease called von Hippel-Lindau disease, or Leaf-Romanes syndrome. These are all syndromic diseases. That is, many people in a family may be affected, or the patient may have two or more cancers, or neurofibroma, we say, where patients
mm,
have these small swellings over
mm,
their body, and that can become a cancer later. But broadly, most sarcomas, we don't know why they come. And when it comes to the symptoms, so or signs, so basically somebody can come with a family history of sarcomas.
mm,
Most people don't. The symptoms are usually a painless swelling and later pain. So basically, the swelling may be in your head and neck area, it may be in your arm, it can be in the leg, it can be in the trunk, and it may be painless to begin with. When it grows, when it encroaches on nearby structures, you may start developing pain. And imagine if a nerve is involved, the pain may be severe, or
yeah.
somebody may develop weakness in a limb. Suppose a
Mm,
sarcoma develops here, then here major nerves are there called brachial plexus. If that gets involved, the patient will have weakness of the limb. They may have difficulty in grip. Okay. So
yes.
these are the signs and symptoms. And when it
Mm,
spreads to other organs, if it spreads to the lung, you develop breathing difficulty. You can develop water formation in the lung called pleural effusions. Okay. They can have chest pain. They can have a lot of cough. If it spreads to the bone, they can have bone pains. If it spreads to the liver, they can have jaundice. To the brain, they can present with seizures. So this
oh,
is all if it spreads. If it doesn't spread, it can be localized. There could be pain, there could be swelling, and it could encroach on the nearby structures.
so, doctor, this kind of a sarcoma is very unpredictable then.
Yes, you have to see whether your disease is localized,
Hmm.
locally advanced, that is, it is encroaching nearby structures, or whether
Hmm.
it is metastatic. It has spread to other organs.
Oh, so doctor, there is any, what are the typically like diagnosis? How can we diagnose this sarcoma?
So we've always discussed this, right? To diagnose a cancer, there are three things. One, we will do a tissue biopsy to
Hmm.
find out what it is. That gives us the diagnosis of cancer.
Hmm.
So a tissue biopsy is essential. It tells you what type, whether it is cancer and what type of cancer. Is it a sarcoma, type of sarcoma like lipo, synovial, leiomyo? In that also, what is your grade, etc. So the
Hmm.
first step to establish a diagnosis is a biopsy. The second thing is we are going to stage the disease, where all the disease has spread. So suppose you have a tumor in the leg, you will
Hmm.
probably do an MRI of the leg to see whether it is involving the nerves there, blood vessels there. Because when you are going to operate, the surgeon should beforehand know that it is away from the blood vessels and the nerve. If it is encroaching on the blood vessels like this, then the surgeon cannot reconstruct.
Yes.
So
Yes.
that an MRI will tell you. So for the local area, you will do an MRI if it is the legs or the hands. If it is the abdomen, you will do a CT scan. And then you will do a CT of the chest or a PET CT scan or an X-ray to decide if the disease has spread to the lung. Sarcomas commonly spread to the lung.
Oh,
So this is your staging. So staging is either an MRI for extremity sarcomas with a
hmm.
CT chest to detect spread to the lung. If it is an abdominal sarcoma, you will do a CT abdomen, CT chest. Then finally, you will do tests to know the fitness of a patient. I may have sarcoma, but I may be very, very, very unfit. I may be 80 years, I may be
Hmm.
bedridden. So you will do basic blood tests like blood picture, kidney function test, liver function tests. So test to diagnose is a biopsy, test to stage is a scan, test to evaluate the general health of a patient.
Okay, okay. Doctor, like, is there any age barrier, like only this set of patient can end up having sarcoma like
No,
that?
but at certain age groups, like I said, Ewing's and osteo, you commonly seen between 10 to 20. Osteosarcoma sometimes can present after 50 in patients who have a disease called Paget's disease. Otherwise,
Okay.
most sarcomas are seen above the age of 40 years.
Hmm. Oh, so even the age barrier is
It's
not.
unpredictable. Some sarcomas don't, so generally sarcomas don't go to lymph nodes, but some sarcomas go to lymph nodes, like synovial sarcoma, clear cell, angiosarcoma, rhabdosarcoma, epithelioid sarcoma. We call it
Okay.
SCARE, SCARE. S for
See that.
synovial, C for clear cell, A for angio, R for rhabdo, E for epithelioid. So these go more to lymph nodes. Otherwise, most sarcomas spread to the lung.
Okay. Oh, so
When you
doctor,
see a
like,
sarcoma with a big lymph node, then you should not say, no, 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 the sarcomas don't go. You should immediately start thinking it could be one of these five histologies.
oh,
So
so
the
doctor,
clinical presentation itself can give you a clue of what you should see under the microscope.
in short, doctor, if there is a small lump on hand or anywhere, it's better to go and consult a doctor before delaying it.
Always a lump which has been there, a new lump or a lump which is growing in size or anything which is ulcerating or bleeding or
Hmm.
something doesn't look right, just go and consult your doctor.
Oh, doctor, like while you were talking about the diagnosis, is there any, like, what is exactly a role of molecular testing in sarcoma?
So now what has happened is earlier we were very happy to say you have sarcoma or not. Then we said, okay, you have liposarcoma, leiomyo, etc. Then to confirm the diagnosis, you have certain molecular methods. Now, for example, Ewing sarcoma, there is a particular translocation. That is, two chromosomes are getting involved. We call it 1122, okay, 922. So if those translocations are there, synovial sarcoma, X18, we call it.
Mm-hmm.
X18. So these translocations, clear cut will tell you that this is the diagnosis because
Okay.
many times morphology looks same. Morphology means to the pathologist, the cells may look the same.
Hmm.
But once you say you have X18 on molecular translocation, it means you are dealing with a synovial sarcoma.
Oh.
So molecular testing helps you to establish the diagnosis even more clearly.
So it's like a clear-cut stamp confirmation that what kind to plan the treatment, I guess.
Not all sarcomas have molecular translocation, but most have. And this is an evolving field. Every day new science is coming up. So we should do molecular testing in all our sarcomas to find out the molecular genomic alteration. We call that.
Okay. So, doctor, like once this molecular testing is done and that part is taken care, then after that, there will be like any directly treatment they will proceed or only without just for medication, everything can be taken care
No,
like
your
that.
treatment will depend upon your stage. If you have localized disease, the treatment is surgery. If the
Okay.
disease has spread to other organs, it is not surgery, it is going to be chemotherapy.
Okay. So, doctor, just when you are telling about, can you just brief on what are the treatment option available right now for sarcoma?
So always understand surgery is the primary treatment option.
Hmm.
Surgery is the only option where you can cure the patient. Surgery is the only option where surgery is the option which you are using when you have localized disease. So imagine somebody has a tumor in the limb. If it can be completely removed, you should do surgery.
Okay.
Now, sometimes we give chemo before surgery called
Hmm.
neoadjuvant, and
Hmm.
sometimes we give chemo after surgery called adjuvant.
Okay.
So many times, for example, you have an osteosarcoma or an
Hmm.
Ewing sarcoma. These are bone tumors.
Hmm.
First, what we do is we stage. Imagine it has not spread anywhere. It is in the thigh bone
Hmm.
or it is in the knee, exactly in the area of the knee. Okay, your
Okay.
thigh and your leg, it is in this area. So, most of the time, what will you do? You will say, I'll cut off your leg. So, you are
Okay.
undergoing an amputation. So,
Hmm.
now you have developed limb salvage surgeries. That is,
Okay.
limb salvage. You can save the limb.
Hmm.
For that, what you will do is the surgeon will say, okay, we will do a limb salvage. You start chemotherapy first.
Hmm.
Do it for 2-3 months. That is called neoadjuvant chemotherapy.
Hmm.
You will shrink the tumor. If the tumor shrinks, we also know that it's a responding tumor. I
Yes.
will also get 2-3 months to prepare an artificial prosthesis for this patient. That's what the surgeon will tell you.
Okay.
The surgeon cannot prepare a prosthesis the same for everybody. No, your leg is different, my leg is different, a small boy's leg is different.
Yes.
So, neoadjuvant chemotherapy in osteosarcoma is given to give time to the surgeon to prepare a prosthesis, to shrink the tumor, make the surgery easier, and to assess the nature of the disease, whether it is responding or not. Other sarcomas, if the tumor is more than 5 centimeters, if it is high grade, if it
Hmm.
is going very deep into the tissues, you give
Hmm.
chemo to prevent it from coming back after surgery. So
Okay.
in those sarcomas, suppose you had a sarcoma in the, uh, say in the arm, soft tissue sarcoma, you remove it, or you had a soft tissue sarcoma in the leg. It's not a bony sarcoma. Bony is osteoidevils.
Hmm.
Once you remove it, if it is above 5 centimeters, if it is high grade, then you will give radiation to that area so that it doesn't come back there.
Yes.
So we spoke about surgery, which is for cure, which is in localized disease. We spoke about chemo before surgery in osteo weavings to give time to the surgeon to prepare prosthesis. And we spoke about chemo after surgery to
Ah,
prevent recurrence. And we also spoke about local radiation to prevent recurrence.
okay.
Now, if your disease spreads to other organs, it becomes
Hmm.
metastatic. Here you will
Okay.
give chemotherapy, or you will give medicines like tyrosine kinase inhibitors or tablets, which we have discussed in diseases
Yes.
that exist in imatinib, in CML, etc.
Hmm.
So any of these options are there, but they are not for cure. They are for control and prolonging somebody's life. That's
So
for palliative.
once, hmm. So once, doctor, if the sarcoma has spread, then the cure is very difficult.
Cure is difficult. Your treatment will also be based on the speed of spread. Imagine somebody had a tumor of 1 centimeter in the lung in January. Now
Hmm.
it is 1.4 centimeters. It is not growing at all. It's growing very
Yeah,
slow.
slow growth.
You need not hit it hard with chemo. You can closely observe this patient and start chemo when really necessary. On the other hand, if you have multiple lung mets,
Hmm.
progressive, patient
Hmm.
is symptomatic, then you need to start chemo as soon as possible. Otherwise, this patient will not get better.
Sir, what about like if it goes spreads to somewhere in the brain or somewhere in the unoperatable place, then at that time?
Radiation. When it goes to the brain, when you cannot operate, if it is multiple brain mets, you have to give radiation to the brain to control the disease in the brain.
I don't know, doctors, like listening to his sarcoma is if it is common or is it very common cancer, doctor?
Yeah, you cannot say it is extremely common, but it's not very common like a breast, lung, or a head and neck cancer or a cervix cancer.
Hmm.
For cancer specialists, it's fairly common. You do see patients in the clinic.
Listening to this, it seems that sarcoma is, as we have already discussed, it's very unpredictable, but it's quite dangerous as well. Like,
So you never know. As you said, it is extremely unpredictable. Somebody's sarcoma may progress so bad it doesn't give you time. Somebody's sarcoma may
oh,
remain indolent. Indolent means very silent for many years.
okay. Generally, we always hear that lung cancer is very dangerous, oral cancer is very dangerous, breast and cervical is dangerous. But in fact, doctor, frankly speaking, even sarcoma is one of the cancer which is also very dangerous.
It's unpredictable. Some people keep presenting with recurrence for which medications don't work.
Oh, oh. So,
And
doctor, like after the treatment of sarcoma, what is generally the prognosis of the patient?
prognosis purely depends on your stage. If you have been if surgery has been an option for you, if you have been
Hmm.
operated completely, then your prognosis is much better. For a
Okay.
patient who has stage 4 disease, the prognosis is going to be very poor. So some diseases, when it affects the lung, when it is a rapid progression, then
Hmm.
patients don't survive for more than a year. But some diseases, they can just remain silent and
Hmm.
they do well for 3 to 4 years also, even in the stage 4 setting.
Oh. Very difficult. So generally, any patient with sarcoma, what is the lifespan, doctor, on an average? Is it
You cannot give a figure like that. You
okay?
really cannot. Now, if you look at osteosarcoma and Ewing sarcoma, if you look at localized disease, you're looking at a 5-year event-free survival of somewhere between 50 to 70%. That is, you're planning to get most people out of the disease.
Hmm.
Maybe out of 100, 60 to 70% of the patient should be fine.
Hmm.
Okay, the remaining 30, 40 can get back the disease at some point in time. Usually it comes back, if at all, it comes back within the first 1 to 2 years.
Oh,
Very rarely after the
oh my God, doctor, it's really then, frankly speaking, sarcoma is one of the cancer which everybody should be aware of this. I
should be
guess,
aware. It is super complicated. Histology, there are 100 histologies, molecular alterations are there. So it is very difficult nowadays. It's very difficult, I mean.
in fact, like even for a common people, everybody are aware of breast, oh, as we have discussed, oral, lungs, breast, ovarian. But I guess nobody is much informed that even sarcoma is so dangerous cancer or it's so complicated cancer.
So we should
Everybody
understand
should.
that sarcoma exists. It can present as a painless or a painful swelling. It can present in the extremities or anywhere in the body. Okay,
Hmm.
biopsy is essential and it is unpredictable.
Oh, doctor, like listening to this, only July is not the month where the sarcoma awareness should be initiated. It should be for every 12 months. So, is there any impact like the nowadays the lifestyle change, like everybody enjoys smoking, drinking, lifestyle, fast food, even that can impact some sarcoma? Is it something linked with that?
It is not linked directly that
Hmm.
any of this leads to sarcomas or this one, but obviously, as we always emphasize,
Hmm.
uh, we would discourage people from any of these kind of habits.
Okay. And doctor, is there anything like some other cancer, like lung cancer or stomach cancer, or that can lead to sarcoma? I don't think so, no?
No.
No. So sarcoma is
So,
self-born.
correct. So now sometimes, just because you asked that, now
Hmm.
you have kidney cancer, which we
Yes.
call renal cell carcinoma.
Hmm.
Broadly, renal cancer is clear cell versus non-clear cell, we say. In that, there is a variant called sarcomatoid variant, which behaves very badly, which is aggressive. The cells look like sarcoma cells or sarcomatoid cells.
Okay.
So, nothing goes into a sarcoma. Kidney cancer will never change into a
Hmm.
sarcoma. But
Hmm.
there is a variety of kidney cancer called non-clear cell cancer where you have, we call it sarcomatoid carcinoma. It is not a sarcoma, but the cells look like a sarcoma.
Oh. So in short, doctor, sarcoma should also be named as very aggressive cancer.
Sarcoma, more than that, we cannot label it as aggressive upfront because some do well,
Hmm.
but we should understand that these are the symptoms and it is not rare and these are the precautions to be taken.
Thank you, doctor. This is something a very in-depth information about sarcoma. Frankly speaking, many of my friends only or in the office, I can ensure that 80% of the people will not be so aware about sarcoma. They might have just heard the word, but they have never predicted what exactly is that. Everybody are like just they get fear that oral, lung, breast, they get that, oh, these are the cancer which creates a fear in their brain or in their mind. But sarcoma is also one of the cancer which everybody should be aware of.
Definitely, that's something which we should strive to. People should come to know what it is and how it presents, and
Yes,
that
yes,
there is some disease like this which exists, and we have tried to keep it very simple today. It's a very complicated
yes.
topic. We've tried to keep it very simple so that people at least know the basics.
And sir, when you are telling about the types of sarcoma, that itself claimed that how much big, you can say big chapter or a big lesson can be created on sarcoma. Thank you very much, doctor. This session is a really very informative to many of the people who are like also who doesn't know what exactly is sarcoma. Even for those also who are not aware of the word at sarcoma, because everybody know carcinoma, but sarcoma is a very word which is rarely used or rarely discussed among the people. Doctor, would you like to give any closing message to this sarcoma awareness?
So, bottom line, sarcomas present as swellings, can present in any part of the body. get a biopsy done, send it for molecular analysis, stage the disease, whether it has spread to other organs or no, generally goes to the lungs. If it has not spread, your doctor will ask you to get a surgery or chemotherapy prior to surgery if it is not resectable initially. Surgery, after surgery, chemo or radiation may be needed based on the grade of the tumor, size of the tumor, depth of invasion. In Ewing's and osteosarcomas, they present in the young adults or adolescents where we give chemo followed by surgery followed by chemotherapy.
Mm-hmm.
Um, Radiation sometimes is done in Ewing sarcoma in areas where you cannot operate. Now, suppose you have a Ewing sarcoma in the rib, you may not be able to
Mm-hmm.
operate for flat bones, we say. There you will give radiation. Otherwise, chemo is generally given prior to surgery in both these diseases. And the prognosis entirely depends on the stage of the disease, the grade of the disease, the tumor size, etc. So people should understand that when you have a swelling which is growing in size, a new onset swelling anywhere in the body, um, and if it is growing, please take medical attention so that hopefully it's not a so that you're even if it's a sarcoma, you're catching it pretty early.
Thank you, doctor. Thank you very much. I hope this message will ensure that everybody gets aware of sarcoma and they won't ignore any lump which is seen on their skin, under the skin, or on bone, on hand, anything. So I hope everybody will just have a at least consult to the oncologist doctor, which can guide them what to do and what can be the right step to do.
Yeah.
Thank.
So just just to add on that, people should not get worried about every small swelling in the body
Yes.
because see that's they are very common. We call it lipomas or fat swellings. The aim
Hmm.
here is not to scare people, but what we should understand is sarcoma commonly presents as a swelling. So a swelling which is growing and which has been there for a very long time or which is growing quickly rather. So do not neglect it. But don't think that every swelling is a sarcoma. It is not
Yes.
like that. Most likely there could be benign swellings called lipomas. Okay. But just be aware that there is an entity called sarcoma. And if you have a doubt, go and seek medical attention.
Thank you, doctor. Thank you. You rightly said, doctor, about this. Thank you very much, doctor. Thank you, everybody, very much for being a part of this live session on sarcoma awareness in the month of July. So, wishing you all strength, a good health, and hopefully, everybody will ensure to spread this awareness on sarcoma with all your close relatives and everybody. And let's be aware about sarcoma. Thank you, everybody.
Thank you.
Dr. Sandhya is here.
Yeah.
హలో సార్, హౌ ఆర్ యూ?
Madam, Bhavnara,
నేను బాగున్నాను సార్, మీరు ఎలా ఉన్నారు?
all good, madam.